Hello, welcome to MedZone by Dr.farjana Afrin. Today my video lecture topics anatomy of the hand. This video lecture I divided into two, part 1 and part 2. In part 1 I am going to describe about the skeleton of the hand, osteology, joints, individual bones description, ossification related information, clinical anatomy and radiological anatomy related with the skeleton of hand. In part 2 I am going to describe about the soft part, that means the muscle, vessels and nerve related with the hand. So let's start. So on screen you can see the articulated hand. It has 3 segments total. The first segment, proximal segment, it contains carpals. Carpals are short bone. They are 18 number, divided into 2 rows. One is the proximal row, another one will be the distal row. Then in intermediate segment we are going to get metacarpals. They are 5 in number. Metacarpals are miniature long bone, or we can say short long bone. In the distal segment we are going to get phalanges. Phalanges are 14 in number. They are also short long bone or miniature long bone. Now joints related with the hand. First we have to remember, as the first segment is the proximal segment, that means carpal. Carpal will be attached with the forearm bones, that is the radius. So think like this is the radius. Radius, it will be attached with two carpal, scaphoid and lunate. So here will be formation of a joint. Name of that is called radiocarpal joint. This radiocarpal joint, it is a ellipsoid variety of synovial joint. Then in between carpals, as they are in two row, they are also having connected by joint. We are saying it is called intercarpal joint. Intercarpal joints are plain synovial joint. Then carpal will be attached with metacarpal. As we know, there are 5 metacarpals, so there will be 5 joint. Carpo-metacarpal joint. The first carpo-metacarpal joint is saddle, and 2 to 5th carpo-metacarpal joints are plain. Then among the 5 metacarpals, second to 5th, they are connected with each other. We are saying it is called intermetacarpal joint. Intermetacarpal joints are plain synovial joint. Then metacarpal will be attached with the phalanges. We are saying it is called metacarpophalangeal joint. Metacarpophalangeal joints are condylar variety of synovial joint. Then in between phalanges, we know each finger having 3 phalanges: proximal, then middle or intermediate and distal. Exception will be in the thumb. Thumb doesn't have middle, only 2, proximal and distal. So anyway, in between them also there is a joint. We are saying it is called interphalangeal joint. And interphalangeal joint are hinge variety of synovial joint. So in the skeleton of the hand, these are the joints we are going to get. After the joints, now we are going to discuss about the individual segment bone. Let's first start carpal related some information. Now on screen you can see the different segment. First let's start with the carpal. So carpals are, we already know, they are total 18 number and they are distributed in 2 rows. So let's start from the radial side toward the ulnar side, counting the carpals. So radial side, that means it is the lateral and this should be the medial. So let's start the first row. Number 1, this is scaphoid. Number 2, this is lunate. Number 3, this is called triquetrum and this is called pisiform. This is called pisiform. So scaphoid, lunate, triquetrum, pisiform. This is the first row from lateral to medial. After that, again from the lateral to medial, if we go, number 8, I'm going to start first. So this will be the trapezium, trapezoid, capitate and hamate. So scaphoid, lunate, triquetral, pisiform. These are the proximal row from lateral to medial. And in the distal row, there will be trapezium, trapezoid, capitate, hamate. So trapezium, trapezoid, capitate and hamate. There is a mnemonics to remember these bones from proximal to distal. First, S, she, L for looks, she looks, triquetrum, too pisiform, pretty. She looks too pretty. Then started from the distal row, again from lateral to medial, trapezium, trapezoid, 2, capitate, catch, hamate, her. So, she looks too pretty, try to catch her. By these mnemonics, you can try to remember the carpals from proximal to distal and from lateral to medial. Now, carpals related, we have to keep in mind some information. First things is carpal what type of bones? Carpal bones, they are total 18 number and they are short bones. So, question will come, does all are short bone? No, there is a exception except pisiform. This is a highlighted point we have to remember, except pisiform. So, pisiform what type of bones? It is a sesamoid bones. So, again sesamoid bones means the bones which is developing from a tendon. So, next question will come. So, pisiform bones develop from which tendon? It is developed from flexor carpi ulnaris tendon. Okay. Achha, next question will come. Okay, you said they are short bone. So, what is the composition of short bone? It is composed of spongy inside with a thin coating of compact outside. So, inner mainly spongy bones with a thin layer of coating of compact outside. Now, some questions may be related with the carpals we can ask you, like their shape. Individual carpals have some individual shape for identification. Let's see how they look like. First come for scapoid. If we see scapoid is boot shape. And if we see next lunate, by name we can understand it's look like moon, or we can say crescent shape. So, moon shape, or we can say crescent shape. Scaphoid lunate, then triquetral or triquetram. Triquetral, it is tri, you just remember. So, pyramidal in shape. Pyramidal in shape. Then pisiform. Pisiform, it's P shape. Then trapezium. Trapezium, it is quadrilateral. Trapezoid. Trapezium, trapezoid. Trapezoid, it is shoe shape. Then capitate, it is the largest elongated. Capitate, it is elongated. And hamate. Hamate is wedge shape and it does have a hook. Wedge shaped and having a hook. So, these are the characteristics features. By seeing, how can you understand what type of bones by shape, how they are look like. Capitate, you just remember it is the largest carpal. So, it is also a highlighted point we have to remember, it is a largest carpal among all the carpals. Okay. Now, if we see these all bones, some questions clinically also we can ask you, like largest carpal. Already we know answer should be capitate. These carpals, it does have the ossification to appear in different month in the person, but which carpals first started to ossify, which carpals last to start ossify, this type of question also may can ask. So, carpal first start ossification, it will be on the second month, first to second month, that will be also capitate, 1 to 2 month of age. Then which carpals last to start ossify? As we know, the pisiform bones, it is developing from tendon, So it is a sesamoid bones. So these bones will be last to start ossify. So pisiform is the last bone to get ossified. Then we can also ask you questions related with the carpals. Commonly dislocate carpal. That will be because of its shape, moon shape, crescent shape, that is lunate. Then we can also ask you commonly fracture carpals. You have to remember that should be scaphoid, and it mainly get avascular necrosis. Avascular necrosis happen in 10 to 15% cases. Not every individual scaphoid fracture means there will be avascular necrosis. Now, in this 10 to 15% cases, why there is avascular necrosis, and in other cases, major cases, why there is no avascular necrosis. Let's see why. First of all, this is scaphoid. Think like this is also a scaphoid. Let's denote figure A, then figure B. Now, in figure A, we will be observing the vascular pattern will be one for artery for proximal and one for distal. So, this is the distal area and this is the proximal area. So, individual artery for distal segment and for proximal segment. Here in the figure B, we will be observing only single artery coming from the distal area supply and heading toward the proximal area to supply. So, from distal the artery is heading toward the proximal section. Now, in both cases, if there is fracture here, what will be happen? In figure A, as there is individual two segment artery, so this area both will be getting supply, no problem. But in figure B, if there is a fracture here, the proximal end will be not get oxygenation because the artery is approaching from distal toward the proximal area, and that are those 10 to 15% cases where single artery approaching from distal segment and heading toward the proximal segment to supply, and in that cases there will be the avascular necrosis of the scaphoid. Now, one more key point you just remember related with this avascular necrosis clinically. Clinically, there will be two key points. Number one is patient may be history of fall on outstretched hand, history of fall on outstretched hand, pressure on the wrist joint area. Number two key point, which is very important for us, there will be tenderness. Tenderness positive on anatomical snuff box. So, patient has history of fall on the outstretched hand, brought to the OPD, swelling and tenderness over the carpal regions area, tenderness positive on the anatomical snuff box, and in the radiology image also they are showing there is fracture of the scaphoid. What type of necrosis commonly happen? Answer should be avascular necrosis. And which type of cases? 10 to 15% cases where single artery approaching from distal end toward the proximal end to supply. That's all about the carpal related osteology information. Now, we are going to see the radiological image and try to identify the different carpals. Now, on screen you can see the X-ray image of the articulated hand, more specifically showing the carpals. So, how to identify what carpals names and how we can confirm this is that carpal. First of all, we have to remember this is the lower end of radius. With the wide end, this is the lower end of radius and this is the lower end of ulna. And we know radius is directly related with two carpals. What are that? Scaphoid and lunate. So, scaphoid, lunate. After that, we know proximal row have four bones: scaphoid, lunate, triquetral, pisiform. So, this is the triquetral. Now, over triquetral, you can see there is a more hypoechoic area or more whitish area, if we want to say in our common language. This is the more dark, whitish area. This is actually triquetral over sitting one more bone, that is the pisiform. It's a more radio opaque shadow. That's a double shadow is here actually. So, we got proximal row four bones. Number one is scaphoid, number two lunate, number three triquetral, and number four pisiform. On distal row, again we will start from the radial side. Trapezium, trapezoid, Then this is a large carpal. We know largest carpal. What is this? Capitate. And this is the hamate. This is the hamate. So in the distal row there are again 4: trapezium, trapezoid, capitate and hamate. Sometime maybe they can ask you, show me the hook of the hamate. This one more whitish hypoechoic area, this is the hook of the hamate. Okay. So carpal identification is only important here. You have to identify the carpals. Maybe they can ask you, show me the pisiform. Maybe they can say you, show me the hook of the hamate, or maybe they can say that identify the carpals or identify the capitate. Like this way, they may radiological anatomy time questions time they can ask you. So that's all about the carpals related information. Now we are going to discuss about metacarpals. On screen, you can see the metacarpals and phalanges. First, we will see the image, then I will be informing you the information related with the metacarpal and phalanges. So, you see, total number of metacarpals are 5 in number and phalanges are 14 in number. Okay. So, first let us start with the metacarpal. You will see the metacarpal, there are 5 and we have to always start to count from the radial side. This is the radius, this is the ulna. So, radial side to ulnar side. Thumb, this is the first metacarpal, this is second, third, fourth and fifth metacarpal. Okay. Now, each of the metacarpals have 3 parts. One part which is related with the carpals. This section we are saying it is called base. What is this? It is base. Then in the middle area we are saying it is called shaft, and the distal area, or we can say it is called, as it is round, we are saying it is called head. Okay. So each of the metacarpal having 3 parts: base or proximal end, shaft and distal end, or we can say head. Same like in the first also, base, shaft and head. Then in case of first metacarpal, you can see there are some features. First metacarpal compared with the other metacarpal, it is little bit short and stout. And second, third, fourth and fifth, they are connected with each others. But the first metacarpal, because of 90-degree rotation, it will be not attached with the other metacarpals. Even in the first metacarpals, we will get sesamoid bones also. We will get sesamoid bones also. That's all about the metacarpal related information. Ossification I will say after some time. Now come for phalanges. Each finger having 3 phalanges. The first, which one is attached with the metacarpal, this is the proximal, then intermediate, then distal. So each having 3: proximal, intermediate or middle and distal. Proximal, intermediate or middle and distal. So there are 3. In case of thumb only there will be 2. This is the proximal and this is the distal. So which one is missing? Intermediate is missing here. No intermediate phalanges will be there. That's why total number are 14. Same like the metacarpals, phalanges also having 3 parts. One is the part which is attached with the metacarpal. We are saying it is called base, then shaft, and there will be the distal end, or we can say head. So parts related with the phalanges I said, parts related with the metacarpal also I said. If there are 3 phalanges, how many joints they are forming? Commonly we are asking. So you just see here, this is a joint, this is a joint. So here will be the proximal interphalangeal joint, I am writing in shortcut, and this should be the distal interphalangeal joint. But in case of thumb, only one interphalangeal joint. Okay. So this is all information related with the metacarpal and phalanges. Now if we want to know more organized way, some of the peculiar features related with the first metacarpal and ossification. So let's learn. So related with the metacarpal, we have to remember the metacarpals, they are miniature, or we can say short long bone. Now maybe your teacher asks you, what is the difference between a typical long bone and a miniature long bone? Number one difference is their length is short compared with the typical long bone. This is a typical long bone and this is a miniature long bone. Okay. Then typical long bone, both end contain epiphyses, but in case of miniature long bone, only one area will be having epiphyses. This is the basic difference among these two. So they are miniature long bone contain single epiphysis. either into the base or into the head area. That we will come to know slowly. Okay. Then parts. Already I said what are the parts of the metacarpal. There will be proximal end, or we can say base. Then there is shaft. Then there is a distal end, or we can say head. These are the three parts of a metacarpal. Now, ossification related information. First I will write ossification. As this is a long bone, a category of long bone, so there should be a primary ossification center in the shaft which is containing diaphysis, same like the typical long bone, and there will be secondary ossification center which is developing from the epiphysis. So, the primary ossification center I am writing in shortcut. The primary ossification center will be in the shaft, appear at the age of 9th weeks of intrauterine life. And the secondary ossification center, it is little bit different in different. What are that? The second, third, fourth and fifth metacarpal. Here it will be appear at the age of second year. Even for the first also it will be appear at the age of second year. But fusion happen in different age. In case of second, third, fourth and fifth, the fusion happen at the age of 16 years. And for the first, the fusion happen at the age of 18 years. So, fusion is different age. Related with the fusion you have to remember, because this is the point from where question can ask you examinee, that in case of first metacarpal, it's appearing secondary ossification center in the shaft appearing into the into the end appearing into the second years, but fusion with the other area will be at the age of 18 years. But in case of second, third, fourth and fifth metacarpal, it appearing also into the second year, but fusion happened little earlier compared with the first metacarpal at the age of 16 years. Okay. Now, what are the features or special features, or we can say peculiar features related with first metacarpal? Already I said that it is little bit short compared with the other metacarpal, short and stout. Okay. Number 2, we have to remember it is rotated 90 degree. It's rotated 90 degree medially. That's why it will be not making any intercarpal joint with other intermetacarpal joint with other metacarpal. So, not making joint with other metacarpal. Okay, it's a point we have to remember. Number 3, we will see its base. Base having a very special features of concavo convex. Okay, convexo concave. That's why, because of these special features of convexo concave, it is making carpo metacarpal joint which is a saddle, but other carpometacarpal joint are plain. Then, as I said, in the distal end there is a formation of sesamoid bones. There is formation of sesamoid bones. Now come for the epiphysis. It has epiphysis on the proximal end. Epiphysis on proximal end. It is a very unique features for the first metacarpal. But in the other metacarpal like second, third, fourth and fifth, their epiphysis is located into the distal end. This is very unique information we have to remember. So, location of epiphysis is also quite unique in case of the first metacarpal. So, first metacarpal is compared with the other metacarpal little bit unique. Okay. Now, related with the phalanges, what are the information we have to remember? Okay, phalanges, as I said, total number of phalanges are 14. For each finger there are 3 except the thumb which having 2. So, again, what are the parts? If we see the parts are same, proximal, or we can say base, then shaft will be there, then distal end, or we can say head, and each finger contain 3. What are that? Proximal phalanges, then intermediate phalanges, then distal phalanges. In case of thumb, there will be no intermediate, or we can say medial, no intermediate. So, in thumb there is only two, proximal and distal. Now come for the ossification. We know there are two ossification, primary and secondary. First I am writing primary ossification center, I am writing in shortcut proximal phalanx. As we know there are three, so proximal, then intermediate, then distal, and all will become in the intrauterine life before the person get birth, that means inside the mother womb. In case of distal, it will be appearing at the age of 8th weeks of intrauterine life. Intermediate will be appearing 12th weeks of intrauterine life, and proximal will be appearing at the age of 10th weeks of intrauterine life. So, first appearing the distal, then proximal, in the middle there will be the middle coming at the 12th weeks of intrauterine life. In case of secondary ossification center, again I am writing in shortcut, it appears for all, it will be appear proximal, intermediate, distal, for every it will be appearing at the second years, and fusion for everyone will be at the age of 16 years. There is no exception like the metacarpals. Okay. Now, where is the location of epiphysis? You just remember the epiphysis also located into the proximal end. So, location of epiphysis. Location of epiphysis will be also as like the first metacarpal, it is also located into the proximal end. So, exception will be only into this second, third and fourth, where the ossification center is located into the distal end. You have to remember this point for MCQ. Now, let us see radiological information related with the metacarpals. So, first let us make this figure A and this is figure B. Okay. On figure A, you can see we have to remember this is the first, second, third, fourth and fifth. The first metacarpal base having a fracture. So, base of the first metacarpal fracture, we are saying it is called Bennett's fracture. Okay. Now, on figure B, you can see again first, second, third, fourth and fifth. So, head of the fifth metacarpal get here fracture. This fracture we are saying it is called Boxer's fracture. Boxer's fracture. Okay. One is Bennett fracture, which is happening to the first metacarpal base, and one is the Boxer's fractures, which is happening to the fifth metacarpal distal end, or we can say head. Now, here though it is not related with fractures, you just see the first metacarpal, as I said, there is a sesamoid bones. You can figure B also you can see on the femur aspect there is a sesamoid bones. Here also in figure A you can see there is a small sesamoid bones related with the distal end of the first metacarpal. So, that is all about the osteology related information of the articulated skeleton of hand.